Hello, my name is Tina Hendrick. I am an OBGYN that works for Ob Hospitalist Group. I'm a market medical director and a site director for a hospital in Kentucky, and I'm here today to tell a life-save story. This happened a couple months ago. We had a private physician who had performed a C-section on a patient. It was a scheduled C-section, so the patient hadn't been laboring or anything. And C-section was completely unremarkable. Everything went very well. The only problem with the patient was that she had high blood pressure. She had preeclampsia or toxemia. So she was on a medicine that we call magnesium, and it is to help with the preeclampsia and prevent seizures. But sometimes it cannot allow the uterus to contract down and quit bleeding after a C-section. But otherwise, she had been doing great, had minimal bleeding and no problems at all. Then later on in the evening, I was contacted by the nurse because the patient was in a lot more pain and her blood pressure was low and she just was not acting right. So they had me come in, and sure enough, her blood pressure was very low for her. And she would talk to me, but only when I would really get in front of her face and make her look at me to talk to me. She was exquisitely tender on her belly anywhere that you touched. So two things were going through my mind. Either I thought I was 99% sure she was bleeding somewhere, but I didn't know if it was outside of the uterus where the C-section scar had been, or was it inside the uterus? And that makes a huge difference in terms of what surgery and just how you manage it. I had them, obviously we had already called her doctor by then, but her doctor's about 10 minutes away. I got an ultrasound and started getting some lab work just to kind of see how far her blood count had dropped and just how her body's responding to this blood loss. And I got an ultrasound and was able to see that she was actually bleeding on the inside of her uterus rather than the outside. And since she had had a C-section, her cervix wasn't open, so she had no bleeding down below. So it was kind of hidden. So a difficult diagnosis to make, especially if you don't have any ultrasound or anything. We then were able to get her back to the operating room and do the correct procedure. By the time her primary care doctor had gotten there, we had already started a massive transfusion protocol, which is we just call a blood bank and we tell them that, and they start sending lots of blood and all of the other stuff that we need, so we don't have to individually order everything. It's absolutely fantastic. So we started that going and took her back to the operating room, and we had her all set up. And as soon as the surgeon walked in, we were all ready to go. I was getting everything started, was getting ready to do the surgery, and then her private doctor walked in. And literally, this was a life-safe moment. Just to point out the benefits of a hospitalist, the doctor was 10 minutes away. So it would have been an additional 10 minutes to even make that diagnosis. And as rapidly as what she was bleeding and how unstable she was, she literally could have died just with that extra 10 minutes, because we just really didn't have 10 minutes. Because by the time her doctor had gotten there, we already had a unit of blood in her and it was still going. And also I was able to determine what surgery needed to be done, because really if we would have opened her up as unstable as what she was, I'm not 100% sure she would have made it. So it was absolutely imperative to make that correct diagnosis. And since I was there to do that quickly, the patient had a very great outcome and is alive and well with her baby today.